Hi, I'm Anne Hepworth. I'm the Director of Strategy and Partnerships at BHRUT, which is the short way of saying it. Thanks, Rich. And so we're in a large acute trust in North East London, quite a crowded patch there in terms of partners. A crowded patch in terms of people and getting more crowded by the day as population growth is one of the biggest challenges that we have and that our strategies need to help us to address. And the other thing, poverty. So those are the two key drivers in terms of our strategies. We've been working with Kaleidoscope over the last year or so on our organisational strategy. And I saw at the start one of their missions is to bring joy. And it has been quite joyful actually, working with them. And the real value that I think we've got out of working with Kaleidoscope is we needed to understand how we do strategy, and how we do strategy across our organisation. And that's what they've helped us to do, is come together to start to think through how we do that. So I've got 5 minutes just to talk about, huge subject here, and just to bring perhaps a bit of practical insight into what we're doing. So I'll talk about developing organisational strategy within a group of partnerships, and then just briefly touch on partnership strategies and how we've been developing those and what's helped and what we need to continue to do to help do that. So if we start with the organisational strategy, so us. Two acute trusts there, where the little red dots are on the map, and a number of other services beyond that. What's our purpose as an organisation in a changing landscape is part of the conversation that we've been having. And I think in the first seminar in this series, there was quite a bit of conversation about how do you engage staff in doing that. And I think as we develop our organisational strategy, there is something about thinking about how we engage our organisation with other partners' strategies as well, because connecting me into something amorphous like an organisational strategy is difficult enough. But actually connecting something as amorphous as an organisation into something even more intangible, like a place-based partnership or an integrated care system or into an acute provider collaborative is even more difficult. So trying to get that real purpose and that connection is something that's incredibly difficult. And if we don't do that, we kind of run the risk of creating a whole load of woolly mammoths running around North East London, kind of bumping into each other, not properly connecting with each other. So what kind of helps with that? I think one thing from an organisational perspective, we have to learn that we can have multiple identities. So we're not just an acute trust delivering acute services. We are also a partner at place. We are also a collaborator within an acute provider collaborative. We are also part of that broader system. And actually the way that we connect into those different partnerships and those different hats that we wear or those different identities that we wear may be slightly different. So we've been doing some work in terms of how our local residents perceive us and in terms of the outcomes of that and the recommendations. We were dividing it into what do we need to be delivering as part of that partnership? What do we need to be connecting or convening across the partnership? And what do we just need to be there to support? So in terms of our strategy and our organisational strategy and our purpose, we need to take all of that into account as we develop that strategy. So those different identities and those different hats that we now wear as an organisation. And how do we do that? We do that by connecting with our population, because that's the thing that does actually connect the woolly mammoths together. We're serving the same population, so we really need to create insights around that. And data will help us with that, but actually listening to partners helps us with that. And actually just getting out more will help with that as well. And I think particularly in an acute trust, it's really easy for us just to kind of stay within our walls, and actually getting out and understanding the different places that we work in really helps. And just getting the number 5 bus from the front of this hospital to Barking Town Hall will give you more insights in that 20-minute journey than a bunch of data will. So there is something about actually visibly being seen and actually getting out there, which really helps. So the one takeaway from that is what purpose do we have in those multiple identities, and how does that connect back to our organisational strategy? So the second bit then is how we build partnership strategies, and I think George's point about the value that we add is incredibly important, and how do we measure that value is really quite important as well. So what do we do together? What don't we do together? And it's taken us a while to really start to pin that down, because our ambition at the start was we'll do everything together, which has meant that we've done nothing together. And so just being really clear about a few key priorities that we need to be taking is important. The thing that we've learned from that is to hold on to the long-term purpose as well. So in terms of that partnership strategy, it's very easy for us to start to focus on short-term. So the key easy thing for us as acute trusts together is to start to look at collaborative capacity in terms of, say, elective theatre space. Great, but we can then just take a short-term view of this. What does that look like in 5 years' time? And that's the challenge of really starting to hold on to that. But really important is what we don't do together. And there's been things that we've kicked off that we've just thought, actually, that's not about the acute provider collaborative, because that needs to sit elsewhere with other partners, and we just support that. The key learning for me in terms of partnership strategies is time, trust and tenacity. So it takes far longer than I thought it would. It's taken us 2 years to get to a position where we have agreed our purpose and our priorities. So it takes time. Trust is the most important thing to work on, and just getting everybody in the room together is a simple thing and the hardest thing to do, but has a huge impact in terms of how we accelerate our partnership strategies. And finally, just tenacity. It's not a linear process. There's going to be times when it feels good, we've made progress, and there's going to be times when it feels like we've taken 2 steps back. So tenacity is important. And the key to all of that, the time, trust and tenacity, is just making sure that we've got our top leaders really visibly supporting all of this stuff. So it doesn't feel as if it's something that happens over there. It's something that actually helps us deliver to our shared population, and actually helps us deliver to our organisational strategies as well. So those connections across are really important.